And what's the duration of mucositis once you've completed therapy?
Well, that depends. For the patient who's receiving chemotherapy, for most patients, as you know, they go about 3 weeks in between their cycles and they're just beginning to recover for all of their cells when we hit them again with chemotherapy. The good news for chemotherapy in most instances, when patients are done with their therapy, a month, 6 weeks after, as those cells begin to recover, patients in general do not have a lot of mucositis problems afterwards. For the patient that is receiving radiation to the head or neck, those patients are treated every day, 5 days a week for 5 weeks, and there's no break in their treatment, so that at the end of that treatment, the cells of their mouth have been quite damaged from radiation.
Right, and they may even have issues of saliva production.
Correct, and so those patients do, for about 5 weeks after treatment, their problem is excessive amounts of saliva, and almost overnight thereafter, patients wake up, they went to bed with tons of saliva in their mouth, and then from that point forward, they experience what we call hyposalivation or xerostomia, which is very poor production of saliva. And that's caused by the radiation basically burning out the salivary glands.
Carl, are there any food recommendations, foods to avoid? And also people who want to know about taking vitamins and supplements?
Well, as I said, I stick pretty close to things that are supported in evidence, and so I'm not really that familiar with particular vitamins. We don't always discourage patients from taking particular vitamins or other alternative therapies, but we encourage them to share that information with their healthcare team, because in some instances, some of those may actually affect the treatment in and of itself. As far as foods are concerned, obviously things like orange juice, grapefruit juice, lemon,
Acidic.
those things, acidic, and then also peppery things like chili, hot things, salsa, those kinds of things may be uncomfortable.
And as simple as a side effect as it might seem, even to a family member, oh, don't worry, it's just a mouth sore. Untreated mucositis or mucositis that has the potential, when you are already dealing with the susceptibility of infection, can go way beyond one's mouth.
It can be patients lose their life, because we know that about 50% of patients who are neutropenic, who become infected with some kind of bacteria, within about 24 hours, they're multiple organ failure. And so that's why we're always worried about, and this is, as I said, it's an opportunity. The window is open for bacteria to enter. So it is much more than, while the oral pain is important to think about, it's really the infection, and the patient could lose their life.
Well, I want to thank you on a personal level, because until I suffered from mucositis, it's hard to tell someone how absolutely painful, and as you call it, debilitating it is. And I'd like to think that before one starts treatment, they understand that these are all possibilities, and that they have this kind of discussion with their oncology nurses and their doctors, so they are prepared. And in case a symptom does present, that they know it's important to communicate that. You don't have to sit at home suffering. You call the doctor's office, and as you had mentioned, you can ask for your oncology nurse to say, got an issue. You got to call your oncology nurse. I also want to thank you, Carl Brown, in your new role as the president of ONS for the next 2 years.